I was going to say good morning, but good afternoon. Good afternoon, everyone. It's absolutely fabulous to see so many of you coming to join us at our AGM today. So, a warm welcome to you all, and a warm welcome to the Mayor of Wirral, Councillor Les Rowlands. Thank you for your support today. This is fabulous. I hope you're going to enjoy this AGM and also the health fair that's coming up afterwards, so stick around. I'm delighted, actually, that we're holding this fair here. It's our flagship centre here at St Cath's Health Centre. This is a one-off opportunity, not to be missed, because it's brought about by our plans to move our corporate services into this building and into this office space, and that's happening later this month. So we're taking the opportunity to hold the AGM here whilst we have the room. I know I speak on behalf of our board that we're looking forward to being located closer to our clinical colleagues and being at the heart of our services and here in the heart of Birkenhead and Tranmere. The move brings our organisation close together, and the win-win is it also brings us financial savings for the Trust. This has been another incredibly busy year for the Trust. This time last year, we'd just come to the end of our inspection by the Care Quality Commission. As many of you will know, we received an overall rating of good, fantastic achievement, and we're very proud of that. And that has moved us forward in our ambition to be a foundation trust. So Monitor, who are the regulatory body for foundation trusts, are here with us at the moment. I don't know if they're in the building. It's like Big Brother is watching you. Are they in the building? No, but they're certainly visiting key sites and services as part of their assessment of us as an organisation. So I'd like to say thank you for everyone who's been involved in supporting this process, because it has been a big piece of work for everyone here. Our formal meeting with Monitor's board will take place in November, and then we hope to be awarded FT or Foundation Trust status early 2016. So we are all working very hard to get to that point. Our Trust members must now elect our Council of Governors. So last week, on the 3rd of September, we formally began the election process, and so now is the time for members who are interested to put their names forward for election. So all interested parties, please take a step forward. You've got until the 1st of October to decide if you want to stand. And I know that you'll be outside if there are any questions about the process. Elected governors represent the interests of trust members, stakeholder organisations and the wider community. They also oversee the work of the board and help to set the overall direction of the trust. So, as you can hear, it's a very important role, and we look forward to the support of those governors into the future. So, Ali and her team and Dave, wave, because we're hoping to have an enthusiastic group of governors coming forward to form a council in the future. So other news from the past year is the decision by NHS England to choose Wirral to be part of a national pilot for a new healthcare model to help shape a 21st century NHS. So the pilot, known as Vanguard, which isn't an altogether popular name, but anyway, Vanguard will support a new way of delivering more joined-up care in partnership with Wirral Clinical Commissioning Group, Wirral Borough Council, Wirral University Teaching Hospital NHS Foundation Trust, and Cheshire and Wirral Partnership NHS Foundation Trust. So essentially, all the other NHS bodies on the Wirral and our commissioners, the CCG. It presents an exciting opportunity for the Trust, as we are well placed to be central to this new model, which will see patients receiving health and social care away from hospital, closer to their home or community centre. Also, this year, the Trust was recognised as one of only 11 community trusts across the country to be listed among the top 100 best places to work in healthcare. Pause whilst everyone takes that in. I know the team and the staff are proud to be there, and we thank our staff for that. It's in a list that's published by the Health Service Journal, It's a testament really to the dedication, energy and passion for quality care that our staff and volunteers deliver every day. Thank you to all of them. Finally, I'm delighted to introduce to you all our new Chief Exec. This is Karen Howell. Karen joined us early in August. Feels like I know it's still only weeks, but nevertheless, you're certainly making your mark already, which is lovely. Very much leading the team. Karen brings a wealth of experience from across community, mental health, and commissioning organisations. Karen I have no doubt, will be a great leader as we move towards becoming a foundation trust and face the future challenges within health and social care. So please welcome Karen to the lectern.
Thank you. No pressure then, Francis. Thanks. Somewhere around here there's a pair of glasses, because I'm at that awful age now where you've got to look up and then look down and need glasses. So, welcome everybody. A very, very warm welcome to this AGM, which I have to say is not only my first, but I have to say I don't think I've been to an AGM for a long time that's been so well attended. So that says an awful lot about Wirral, doesn't it? I'm delighted to be returning to my Wirral roots. I was trained on Wirral, I was raised on Wirral, and I'm delighted to join such an outstanding organisation. The services that I have visited so far and the staff I've met during my first month, yes, it is only week 6, basically they've blown me away. And they have really crystallised my decision and confirmed it was the right decision to come back to Wirral to take up this post, which I feel very privileged to take up in the NHS on Wirral. Our staff are inspirational and they're motivational, and they're motivated in the right direction, and that's about good patient care. And that's why I returned, because you could feel it, and everywhere I tested, I could see it. As a clinician and a manager of some 36 years, health is my passion. I started as a nurse and I'm still a nurse. I'm still a registrant and I'm very proud to be so. But actually, it's the passion of this organisation. And so is putting the customer, the patient at the heart of everything we do. And for that reason, I wanted to start this presentation by sharing with you a snapshot of the feedback that we get from some of our patients.
And the first day Neve came, she was just like a breath of fresh air. And she sat there, and she just chatted.
Sorry, the VT's a bit late, the audio's a bit later. I just wanted to share these 4 points with you because, and I wouldn't want you to think we've only got the 4, because this is an example, a very small example of the feedback we get from patients from our services. So from the wheelchair service, a husband who's got nothing but help from start to finish with the service. Visits at home, visits to clinics, everybody he's come into contact with has been very, very helpful and supportive. In New Brighton, the community matron and nursing team that have been absolutely excellent, and any time this person needed them, including emergency call-outs, that team was there for them. From the Live Well Weight Management Programme, and this is a very interesting one because this person went to extraordinary lengths to describe to us all the other services that they had tried over years and years to actually bring their weight under control because it was having significant impact on their health. And actually it was our Live Well service that not only changed their eating habits but allowed them and supported them to support those eating habits, and they are now enjoying a much healthier lifestyle. And then there's the nurses in Wirral, the community matron and nursing team, in Heswell, who basically were contacted to say that they touched the hearts of the patients that they treated, and they thanked them for the kind expressions of sympathy, which are much appreciated during a time of sorrow. To actually make that thank you at that time takes some courage, and it actually demonstrates to us that our services are right and are our clinicians go above and beyond the call of duty. What our patients think of us really matters. And last year, the Trust launched its Patient Choice Award. This award gives you, the public, the chance to nominate somebody from our Trust who has given them exceptional care, and we'll be inviting nominations soon for this award again for this year. Last year, we had an amazing response from the public, and our winner from the Nutrition and Dietetics Service epitomises the quality of care we want to deliver day in and day out. The family actually said from the moment they met Neve in our service, she was kind, considerate, professional, empathetic, skilled, and went above and beyond her role. She has provided the family with hope and positivity, and they would have been completely lost without her. Here's an extract of what the patient actually said about Neve. Thank you, Martin.
And the first day Neve came, she was just like a breath of fresh air. And she sat there and she just chatted. And for the first time from the beginning of my journey, I felt like somebody cared about me as a person, not just another patient. Neve was so comforting, not only to me, to my husband. And Neve has been my angel, and she makes sure I get the flavours I like. She brought little recipes. Oh, she's just salt of the earth. I've never met anybody like her. And she's not just Neve the dietitian, she's a friend.
Thanks, Martin. It's wonderful to hear feedback like that. And it's a reminder to me and the organisation that we have a vital role to play in the health of our patients across Wirral and the neighbouring communities. In fact, thank you, Martin. In fact, last year, the Trust saw 1.1 million patient contacts. And for the third consecutive year, we treated all of our patients within the national standard of 18 weeks. And we delivered a range of urgent care services through walk-in centres and GP out of hours that helped us achieve the national indicators of success for supporting the delivery of urgent care across a health economy. That's a serious achievement for a community trust. In fact, it's a serious commitment and acknowledgement of the services in Wirral. Acknowledged by our commissioners and indeed our regulators, we have constantly achieved a high level of performance. And we are now working, as you've heard Francis say earlier, we're now working with national partners and local commissioners to better define the key outcomes and standards that we should be working to in the future for out-of-hospital services. Our strategy is actually hinged around 4 component parts: our patients, our services, our people, that's our staff, and the sustainability of this organisation. For our patients and communities, we continue to listen to patients and staff. And indeed, we established last year a community panel to better facilitate a greater understanding of local people's needs. And as you've heard this morning, this afternoon, that we want to build on that through our governor network. 95% of patients say they would recommend our services to friends and families. And indeed, we continue to work with our patients and their families and carers to raise awareness of how they can tell us if they've got a concern or a complaint. We take them very seriously. We deal with each one individually, and we address any faults, any problems, any challenges in the services that we have to as a result of them. Last year, 100% of our complaints and concerns were acknowledged within 3 working days. I'm sorry about the noise of the paper. Our services then, we can move on. Thank you. Our services, as you've heard already, were rated good by the Care Quality Commission, but in certain parts of our organisation, they were also rated excellent That is one heck of an achievement for any NHS organisation in NHS England at the moment. We're proud that we continue to have safe, high-quality services delivered by skilled, professional and dedicated staff. The new services we've brought online and are bringing online include a Wirral 0 to 19 health and wellbeing service. We've also won the contract in East Cheshire to provide that service because of the services have a demonstrable track record here. We've extended podiatry services into 2 prisons in Liverpool, and we've extended physiotherapy services there into Liverpool as well. And we've created a bariatric service for those patients who are really struggling, being excessively overweight, and this is having an impact on their health. And very excitingly, we've also got more and more, and we're building up a cadre of contracts for our speech and language therapy services into our schools. And this is something we want to actually extend further. Our people then, our staff, we are ranked top of all community trusts for the percentage of staff who would recommend the trust to friends and family. And this is something, for some of you may remember, this is something that came out of the Mid-Staffordshire Review, that if you actually wouldn't recommend your own service, then you need to do something about that service. This is a real accolade, it really is, and we continue to engage with our staff and invest in their development. We achieved 99.9% of staff receiving a developmental career appraisal in 2014-15. That was awarded best in country. Our staff are actively encouraged to be involved in our business planning, innovation and creativity, and generation of new ideas so that we can continue to deliver good service and redesign where we need to modernise services. And lastly, our organisation, our sustainability. Amongst other developments, during 2014-15, we continue to roll out our information technology systems. This is a huge ask for all of the public sector at the moment, but the evidence to date suggests quite confidently that performance of our services and our clinicians has significantly improved by enabling staff to have the information at their fingertips when they need it, when they're treating patients. We're always working with our staff to improve this, and at the moment you will hear that this is a rollout, and what that means is you can't just switch IT on right across an organisation. We have to implement it service by service. So there are some services we've got to get to. Our cost improvement programmes are all quality impact assessed. We take this very, very seriously. Any cost improvements we make are QIA'd, as it's called, to ensure that the efficiency savings we make do not have a detrimental effect on our service delivery right at the sharp end where we interact with patients. And we continue to work with others to ensure we spend taxpayers' money wisely and we achieve value for money and service improvement whilst we're doing that. So, our journey so far then actually started in 2011, and as you've heard, this year sees the Community Trust being assessed by the NHS England regulator monitor to become a foundation trust, and we're very confident and hopeful that this will be by the end of the year. We couldn't do this if we weren't performing well. We couldn't do this if we didn't have patient feedback that we took seriously. And that doesn't mean we just take seriously when we're told we're getting it right. It means we take it seriously when we're not getting it right and we need to change or we need to do something different. And we couldn't do that if we didn't have the support of our staff, who provide amazing services and generally go well beyond that of the call of duty. So looking forward then, we are a cornerstone organisation in the Wirral local health and social care economy. Wirral Community Trust is a significant part of the solution to improve and sustain health and social care for local people. We are uniquely placed, but more importantly, we are uniquely skilled to provide out-of-hospital support and services, to keep people well, to receive prompt care when they need it, and to support those people to live longer independently nearer to or in their own home, whenever we can. Our ambition is to become a foundation trust. It's palpable and it's demonstrable, and people who go to our services come away from those services and say they can see and feel that. We want to continue to work with patients, local people, and our partner organisations right across the public sector, voluntary sector and independent sector to ensure we continue to provide safe and high quality services that remain sustainable, and that's the key to this, for the future of the Wirral health and social care economy. I'm going to ask now Mark Greatrix, our Director of Finance and Resources, to just take you through a financial review of 2014-15. And I think then probably we're going into a Q&A, aren't we, Francis? Okay, so thank you very much. Mark, would you like to come forward?
Yeah, thanks, Karen. Those of you who attended last year will notice that I'm also new to the organisation. I was very pleased to join the Trust in January of this year. And it's my privilege to take you through our finances. I will try not to bore you. I'll talk you through our finances and how we manage them throughout the financial year 2014-15. Talk a little bit about where our income comes from, but more importantly, how we spent it. So, as a trust, as a non-foundation trust, we are subject to the to 4 statutory financial duties, which I'll talk about in a little bit more detail later on. But thankfully, we did achieve them all for the financial year just ended. We received £70 million in total to provide our services, and that comes from a variety of sources. And again, I'll talk about that in a little bit more detail in a minute. Now, you'll be aware that NHS funding is facing unprecedented pressures at the moment. It's all over the press. No one will have escaped that. So achieving any kind of surplus is a challenge in itself. And there are very few trusts that did achieve a surplus last year, and even fewer set to achieve them this coming year. However, we did. We had a plan to achieve a target surplus of £900,000. We actually achieved £875,000 surplus. As you know, accountants like to round up or down to suit the answer they would like. And I would say that we achieved our surplus plan. So we also have to invest money to keep our assets, our buildings, our equipment up to standard. And we invested £1.8 million in capital investment last year as well. And I'll talk a little bit about that. So where does our income come from? As you can see there, the majority comes from the local CCG, £49 million. And that's to provide the majority of our services, as you'd imagine, including community nursing. But we also contract with NHS England, and we achieved £9.3 million from NHS England to provide services such as our all-day health centre, the LISO practice, dental services and health visiting. We also contract with our local authority, and we have a contract with them last year for just short of £8 million. And with local authority, that includes the likes of our Live Well services, which includes smoking cessation and weight management. We also obtain some money for education and training, and this is for training our clinical staff whilst they work for us. So this is to facilitate that training, to make sure that time is released for us to train them, and also that the facilities are appropriate for that training. So that was £200,000. We actually also recover just over £2 million from NHS Foundation Trust, and I must say that the majority of that comes from our local teaching hospital for services that we provide, so we receive some income from them too. And then the other category is a bit of a wash-up, and that includes things such as rent for services that are outside of our organisation, but they use some of our premises. So there's just £1 million there of other things that we've categorised. So how do we spend our money? Well, as you can see there, our employee costs alone represent 65% of our total expenditure. So £45 million is spent on staffing. We also purchase healthcare from non-NHS bodies, and essentially that represents our ophthalmology services from last year. That arrangement has now changed. It will be different in next year's accounts. We also have the cost of our board, the cost of the executive directors and the non-executive directors. All these categories are broken down within our final accounts, so if you wanted to see them in any more detail, you'll see them there. Supplies and services, almost £10 million. That's the cost of providing our day-to-day services. So the cost of our syringe drivers, our dressings, all of our clinical supplies. Premises and transport, obviously the cost of leasing some of our buildings for our gas, our electricity, the general things. I think I've just missed out premises and transport there. We also have £1 million for staff travel. As you can imagine, with a community nursing workforce, it's quite a mobile workforce, and we've got to pay for that travel as well. So we spend almost £1 million just on travel alone. We are looking to invest in some electrical vehicles in this forthcoming year, so that we can try and reduce not only the cost but the impact on the environment too. So that's a summary of how we spend our funding. Depreciation at just short of £1 million there. That's a way of us putting money aside to replace some of our assets. So we charge some money to put that cash aside so that we can build that up to save to replace some of our assets in future years. So I mentioned earlier about capital spend. Capital expenditure is a different pot of money than the 70 million that I've just talked you through. The 70 million is to provide our services on a day-to-day basis. We have a separate pot of money which we agree with the Department of Health in terms of what we are going to invest in buildings and the more substantial elements of our assets. So last year we spent just short of £1 million on a mobile working project, also known as System 1, you may have heard. And this is equipping our nursing workforce, therapy staff, with mobile devices in the form of laptops, so that they can operate more efficiently and be more connected to patient records. All of that will now be stored electronically. So there was a significant investment in that. £500,000 alone was spent on laptops. They need to be of a certain specification, and there's certainly quite a lot of them. There are the project costs themselves, and then there's also some IT hardware that we had to purchase as well to go along with this, to manage the software. So quite a significant investment in IT. In terms of our estate, we're quite lucky to have some very good estate. We've also got some poor areas, but the majority of our estate is in pretty good condition. So we don't have to spend too much at the moment, although we are planning for the future, on keeping that up to scratch. However, last year we did move a few services around. We brought a few services such as the wheelchair services, independent living, palliative care into this building. So we spent just over 700,000 on refurbishing the environment so that would be fit for purpose. So by many standards of other organisations, quite a small capital programme, but nevertheless it's a key requirement. I mentioned our statutory duties earlier. Now this bit will send you to sleep if I go into any detail, so I'll keep this brief. As I mentioned, we are required to either break even or to achieve a surplus. And we had a plan of 900,000 for our surplus, and we achieved £875,000. That was no mean feat. It was a difficult year. We also have a requirement to pay a dividend to the government for the buildings and the things that we own to provide the service, and we have to calculate that and achieve it at 3.5% of our total assets. That's probably one of the more technical requirements, but nevertheless we hit that target. We also agree at the beginning of the year with the Department of Health how much we are going to spend on capital, and last year we said that we were aiming to spend 1.8 million. And we just came up short of that, which is allowable, and we've spent 1.79 million, as I've just talked you through. We also have what's known as an external financing limit. Now, this is a way of managing cash across the NHS so that Parliament can keep tabs on the cash that is being spent. So we are set a target for the end of the year, and I'm happy to say that we achieved that target, and we finished the year with 1.1 million as our external financial limit. So again, we achieved all of our financial targets. Now, in terms of ourselves as a commercial entity, we obviously have to be flexible. We need to be able to respond to opportunities and to tenders that come out for services, and we need to be able to respond to those in a very competitive manner. Karen's already alluded to some of the tenders that we've been successful with, at the likes of the 0 to 19 bid in Wirral and more recently in East Cheshire. Unfortunately, we've also lost out on some of these tenders, and it was very disappointing for the Trust to see the likes of the LISO practice and the Community Equipment Store leave the organisation. But that is the environment we are now working in. More services will come out to tender, and we will do our level best to retain those, and we need to be defending our core business, and we also need to be looking to diversify. We need to be prepared to bid very strongly for those existing services. There will be opportunities elsewhere, and we've already talked about some of those, the podiatry in the prisons and moving into Liverpool. But what we can't afford to do is lose sight of our core services, which is providing high quality, safe services to the people of Wirral, and we won't do that. But the environment that we're in at the moment means that if we need to diversify and we need to expand outside of Wirral, then we will do, because that additional income will help to support our services in Wirral. So what does the future hold for us? Again, you'll all be aware that it's a very, very difficult financial picture for most of the NHS. Karen mentioned we've currently got monitoring, assessing us to become a foundation trust. We, as part of that, had to produce a 5-year financial model. That demonstrates that we've got quite a challenging efficiency requirement. We need to be generating savings over the next 5 years in the region of £3 million every single year. If we do that, we will be generating moderate surpluses. The days of significant services are long gone. We'll be aiming to achieve a surplus this year of 200,000. Now, that demonstrates the difference between this year and the last few years when we've achieved 900,000 each year. So those surpluses look to rise as we move forward into the future, ending up at around £800,000 in any single year towards the latter end of that 5-year model. Now, the beauty of becoming a foundation trust is that we can accumulate those surpluses, we can keep hold of that cash, and we can build it up to take forward and invest in our services in the future. Whereas when you're a non-foundation trust, you don't have that ability because it all goes back to the centre. So that's one of the big benefits of becoming a foundation trust. We hope to be approved as a foundation trust in November of this year, so watch this space. It's also going to be a very challenging year for 2015-16. We have a significant efficiency requirement of 4.6 million. I am, however, very pleased to say that we've made some considerable progress. We only have a very small gap against that now, just over £100,000. There are risks with some of those cost improvement programmes. And as Karen alluded to, we've got a very, very good governance structure. It's very robust. And that does mean that as we constantly review our CIP schemes, some of them will have to be halted because it's deemed not to be in the best interest of our patients and our services. What I can tell you is that before the CIPs progress significantly, the medical director and the nursing director sign them off to say that they are safe to do so. So a very robust governance structure. And finally, just to finish, we're obviously integral to the Healthy Wirral programme and the Vanguard bid, and we are looking forward to focusing very heavily in the next year on working with our partners, both from health and from social care, across Wirral, in terms of integrating our services. And so that's going to be another key focus for us moving forward. And I guess finally for me, it just remains to say a thank you to all of our staff and our volunteers who've played a key role in helping us to achieve a pretty significant surplus last year in very difficult circumstances. There were some tough times, and we had to get our heads together a couple of times during the year to get ourselves back on track and to make sure that we were heading in the right direction. But through the ideas, the innovation, and the contribution from our staff right from the front end all the way up through to senior management, we managed that and we achieved it. And it stood us in good stead for this year too, because we've got, like I say, the majority of our CIP plan for this year is already set. So it's all been achieved against the backdrop of ever-increasing demand for our services, more complex and sicker patients, But we've managed to achieve our financial plan against this backdrop, and yet the quality of our services has never been compromised. So on behalf of the board, I would send out a thank you to all of our staff and our volunteers. Okay, that's it for me. Now moving over to the questions and answers. Yeah.
Oh, I think they're letting me off light. I've only got 3. So it may be, if there are any further questions from the floor, we can take them afterwards. But firstly, let me read this. I think it's mainly about finance. Given the perilous financial position of the FTs, the ongoing cuts to the NHS budget and the activities of community services such as Virgin, disguised as Peninsula, how optimistic can we supporters of the Community Trust be about the future? Thank you. That's a very insightful question. Karen, do you want to start, or Mark?
If Mark picks up on the money, then I'll pick
Yeah.
up on the service.
Okay, yeah, I mean, it's a very good point, and we are, as I've already mentioned, facing one of the toughest challenges that the NHS has ever met. Evidence of that is in the fact that we all submitted our plans, all NHS organisations, and we've recently been written to by Monitor and the Trust Development Authority to stretch those plans and to achieve a better position, which is going to be very challenging. And I've also mentioned that we're also up against competition. We've taken this on board as an organisation. We've improved our approach to our tenders. We've got a very robust system in place now where we evaluate tenders, because it would be no good for us to stretch ourselves too thin. We don't want to be submitting bids for every bit of activity that's put out to tender. We also have lessons learned, so we've got a very robust structure, and we're becoming more commercial. And to that end, we've also appointed a Director of Business Development and Strategy, whose role it will be to make sure that we are commercially focused and that we are putting ourselves in the best position to defend our core services and also to bid for services into the future.
Thanks, Mark. I'm not too sure how much I can add to that, other than to offer an alternative way of thinking, really. Yes, we have to be competitive, and yes, our services have stood up to quite extreme scrutiny over a period of time, and we will continue to do that, and we will continue to work with our staff to help us continue to modernise those services based on what patients and families and carers are telling us, and the professional advancement of that service. But there's also something else to think about, and that is, some of you may know, but I have a career history also, in addition to provision of services, commissioning of services. And actually commissioning we will see commissioning changing over the next few years in terms of how services are secured financially. And that's going to be more about collaboration, and it's going to be more about ensuring that the service is robust and sustainable for the future, rather than about just a competitive edge and the cheapest and the most. So when I mentioned in my presentation that about spending taxpayers' money wisely, and I said we want to achieve value for money, that may be a covert way of saying we don't want to be the cheapest, because the cheapest isn't necessarily the best way to provide a service. What we want to do is provide value for money, and that's the market that we will enter. And actually the Commissioner is now being very clear that that's what they want to commission, because we've all heard of the pitfalls of doing it the other way. So there are many ways in which you can commission services and provide services, and it's not necessarily the greatest number at the cheapest cost. It's value for money, working in partnership, working collaboratively to make sure that we provide the best services for patients, not the best services for an organisation. Thank you.
Thank you. Thank you. That's a very pertinent question, because I do wonder how many people realise that the services that are on offer, because they are allowed to use the NHS logo, are not provided by the NHS, and perhaps it's about educating our patients too. Next question. Does the Trust have any plans to investigate the benefits of the Dutch healthcare system called Buurtzorg? You've heard of it? Yes. I haven't, I'm sorry. Sandra? Yes. You will know all about it, I'm sure.
Thank you. Yes. It's one of 4 models that we've been looking at. There are 4 really interesting developments in Europe. One, the one that you've already referred to, one that is in Germany, one that's in Sweden, and do you know, I can't remember the top of my head where the 4th one's from, but Spain, thank you. That's Karen, who's one of our managers. Karen's been supported on one of the NHS leadership courses nationally, as has Dave, who's sitting here. And these are models that they teach on that course as being examples of best practice. So as a group of managers, what we're looking at is what can we learn from them. But what we're very clear about is we don't just want to take a model from somewhere else and say, we'll do that here. Because we have to understand what we need on Wirral, really understand our population, what their needs are, and what will work best. But all the time, we're always looking at other examples, both nationally, internationally, to say, how could we do this better and deliver best value, but best care as well.
Thank you. Happy with that. Sounds a very sensible way forward. And the third question is a question about the policy of home work-time balance. Many staff are now unable to have reasonable time off for GP hospital appointments unless they pay time back. So the question is this considered to be a positive work-home balance? Jo.
Yeah, I'll take that one. We have made some recent revisions to that policy, which brought us in line with all other NHS trusts, because we were something of an outlier in that respect. And it is about using taxpayers' money appropriately and ensuring that we support staff to attend medical appointments, but that's not at the expense of patient time. It's quite a specific question about a very specific policy that has just been introduced, and I have had conversations quite recently about providing some clarification on that, because I think it's very much about the guidance that we provide for managers in the application of that policy, and it's become quite clear that we need more guidance, because certainly the idea isn't to prevent staff from attending appointments, and we need to provide more guidance to managers to ensure that they apply that in a fair and constructive fashion, and that's what we will do.
Okay, so those are the 3 written questions. I'm sure that the team would be willing to take any questions from the floor, if there are any. Gentlemen here.
Yes, Richard Wenger, I'm a member of the Trust.
Oh, good.
I just wonder what considerations have you sort of thought about in relation to the greater Liverpool area and the mayor and the block of money that will come to that organisation and handed down to you, and what the implications might be?
Are you thinking of what's happening in Manchester and Devo, what they call Devo Mank, and the potential for it to happen here?
I think it is coming here, isn't it? Yeah.
The mayor is probably one of the best people to talk about this, but is there anyone, executive, would you be happy to pick up, Sharon?
I'll pick it up. Thank you, Chair. I caught Richard. Do you mind me calling you Richard?
No,
is that okay? Richard, it's a very real-time question, and actually we have discussed it both in the executive team and with some of our services. What we consider it to be is an opportunity for the organisation. In actual fact, there are many opportunities within that. For those that don't know what is going on, there is a move now in terms of drawing a wider footprint across Liverpool and Wirral in terms of public sector spending and collaboration. We do know, and we have been approached, that services in Liverpool will need to be provided, but not necessarily by those that are providing those services already. What we want to do, and we've already opened up, I've already been over to Liverpool to talk to the commissioners. We want to ensure that the services that we think we could best provide, but also that they'd want us to provide, we can do that. But as Mark has said, all of our decisions are impact assessed, and what I mean by that is we're very clear that Wirral is our core business. We are here to provide community out of hospital services for the residents of Wirral. So we're always measuring how can we do that, but also build the sustainability of our organisation. But we don't consider that a threat. We do consider it an opportunity, and actually there's no reason to think otherwise at the moment. Thank you for the question.
Yes.
Yes, my name's Evelyn Hogan. Just want to know, I'm a patient at the All Day Health Centre, and what is going to happen? Because it's due for a review, is it next March?
Yes, it is due for review. I'm probably going to hand you to Sandra, if that's okay. Thanks, Evelyn. Sandra?
Hello. Yes, as you rightly said, we have been given notice on that by NHS England about that service closing, but we're working very closely with them now about how we continue to provide healthcare around that setting, especially as we're approaching the winter period, to make sure that we can continue to deliver the very best, both primary but then secondary care for patients who need those urgent services. So the service will close, but I think what we will see is there will be different opportunities open up as a result of that. And those discussions are still ongoing at the moment. So I can't give you a full picture of what they'll look like. But NHS England will work with those patients as well to ensure they continue to get the healthcare that they need.
When are we going to let the patients know?
I haven't got that detail because obviously that's a different organisation, but what we can do is from today is to take that query back and get a definite timeline for you.
Because it's not that, because we've had the review for 12 months.
Yeah.
Because I'm trying to get a patient group started up there, so
Okay.
patients know what is going on. So
Yeah.
I'm just waiting for them to come back to
Okay.
me. At the end of the day, people need to know what's going on so they can plan.
Yeah.
Go to all the surgeries.
Yeah, fully understand that. And we'll take that query back to the commissioners for you and follow that up.
Just to finish off, thanks for bringing that to our attention, Evelyn.
I'll just bring one more up.
Yeah.
Right. On the leaflet you have, they have a phone number of 514 2222. And yeah, press option 2, option 1 to get make an appointment for a doctor. All the time I've been there, I've banged on about this for a long time. Why can the patient not have a direct dial to the premises instead of going through a call centre? Because sometimes you can wait up to 10-15 minutes to be answered, and then you get cut off. I have brought this up with John Lancaster last year, but he's retired now. But a few of the patients up there have queried that, but nothing seems to be getting done about it.
Thank you for that, Evelyn. I wasn't aware of that, and I'm sure that is the team aware that it's become a problem? Have we been?
I've told Philippa Crompton about it ages ago. I keep annoying her with it. She just doesn't do anything.
Well, clearly it's irritating you, isn't it, Evelyn?
It's not that, because you're offering a service to people.
Absolutely.
And people should be able to ring through, make an appointment.
Yeah.
All right, they are busy between sort of 8 and 5:30, fair enough, but sometimes I've rung at other times and you can't get through.
Okay. Evelyn, can I say that I would like to look at the reason for that myself and understand it. So if you'd allow me, I'd like to do that, and then we'd like to get back to you.
Yeah.
Have we got your contact details?
I'll give you them.
Would you mind? And I'll make sure that you receive a response. Thank you for bringing that to our attention. Thank you.
Thanks very much. I don't like using these. It's to everybody, really. I was at the meeting last week to become a governor. I've been a governor before for the NHS. What I'm getting at is, and you might be able to bring it up here, late for the AGM because I had an appointment with a class of I've just got here. Regarding the situation for people who need transport to hospital for appointments, and I suppose it's cost effective, that sometimes a taxi is sent. One was sent this morning for somebody, and by the time they got to the front door, after coming down on the stair lift, the taxi had gone. That was at 20 to 9. The person rung up the ambulance service with the next door neighbour's phone, they sent a second taxi, which turned up. Unfortunately, they were waiting for 10 minutes. They looked out the door, and only for looking out the door, the taxi was there, where they flashed their lights, picked them up. By the time they sat, I'll get to this point in a minute, by the time they sat in the taxi and they got the seatbelts on, the fellow was off. By the time they got to the appointment in Clatterbridge, which was for, what you call it, acupuncture, the person couldn't have the procedure for the simple reason is the taxi was late, plus the fact in too much pain from the journey. So I know an ambulance is great, but the taxi driver didn't even know where this person was to be dropped off. He phoned back to the depot or his boss, and they didn't know, so they basically said, just drop them off at the main entrance, and that was it. But the person couldn't actually walk physically, so they ended up being in the hospital for 2 hours and waiting for another half an hour for an ambulance to pick them up to take them back home, which is very distressful for the person, you know, especially when they're in that constant pain, you know.
You're happy to take that? It sounds like quite a specific...
It is, it's very specific, and thank you for bringing it here. Yeah, which is not good. I think the important thing to say is it's actually not this organisation that runs that service or even indeed commissions that service, but what I will do, rather than you being passed from pillar to post to bring this to somebody's attention, if you let us have the detail of that... I understand that, but if you don't mind, what we'll do is we'll take the detail of the issues and we will then pass that on to the organisation that actually provides that service. It's actually a patient transport service provided by North West Ambulance. Yeah. But I will give you a guarantee, we'll pass it on for you. Okay. Thank you.
The gentleman over the far side. Communication. We've got the mic coming.
Sorry, yeah. Can you hear me now?
Yeah.
Right, it's back to something that the lady said about communication. The communication, I would like to know why the hospitals, the GPs, and the various specialised organisations have an aversion to leaving a message on an answer machine when the person hasn't answered their call in the home. This could be that the person takes that extra length of time to get to the phone to answer it, or indeed could be out at an appointment or indeed out elsewhere. And the inquiries I've made, both at Clatterbridge, Arrow Park, and a variety of other areas, is that the policy is not to leave a message to say that they have called, or even, could you please call number XYZ, we called while you were out. I would say each individual patient can give permission for any message to be left there. It's not top secret that, you know, if there's only you and your wife, or you, a wife and a husband live in the house, they each know that they do get these phone calls. I'd like that to be investigated and changed rather rapidly, because it is infuriating with the amount of other phone calls, these chance-type phone calls from India and other places throughout the world, that you get in with 10 messages, and one of them could be very important, but there's no message. It's just a missed call. Thank you.
Thank you. It's like the Karen Hill Roadshow, this, isn't it? Again, thanks for bringing that to our attention, and I can see how that will be incredibly frustrating. And again, unfortunately, this organisation's not responsible for Arrow Park and Clatterbridge Hospital, but what I can do and will do is, if you give us the detail of that, we'll make sure that that's passed on. Rather than passing you on, we'll pass it on for you to that organisation, and we'll ask for somebody to get in contact with you about that. But thank you for bringing it to our attention.
We have another query there, and then a query over here.
Thanks, Madam Chairman. My comment is about something I mentioned last year's meeting about optical and dentistry. In my opinion, they should be free, and the government is now charged. We asked Dr. Ewan last year, He made his comments, and it was actually a written question from somebody else, so there's two people in the room that were interested in that particular comment. I'd like to know where Dr. Ewan is today. Has he retired or has he been replaced? And also, could somebody announce how many members we've now got? I know, because I asked David Hammond before, but I hope somebody would have announced that. But the first part is just in my opinion. Thank you.
Well, firstly, Dr. Ewan Sim is very much still part of the executive team, and he's not here today, but that probably means he's just having a day's holiday. So the next part about services being free, I'm on your side, but I'm not sure the government's listening. Karen, what have you got a comment you'd like to make on that?
Yeah, thank you. I have absolute sympathy with your position. Again, there's nothing really we can do about it other than what we do as an organisation is when we're asked or when there is consultation, we will respond as an organisation on behalf of our patients. And I'm sure you would too. But unfortunately, it is a policy decision. It's way beyond our control. And for those people that are entitled to free services, we make sure that's supported through our processes. But I'm afraid it's getting fewer and fewer. It's way out of our control. And I think actually Dr. Yu might be seeing patients today. I think he's actually in surgery.
Right, there you are.
Which is good. It's a good thing.
Because his role with us is a part-time role, and he is an active GP in the community as well. So he spends half his week with us and half face-to-face with his patients. And you asked a question, was it about the number of members that we have?
Yeah, we've got 5,200 members at the moment, which is above the target that we had. So we're very proud of that because it shows a real commitment from our community.
We're still canvassing for new members, and I've already explained the process for the election of governors. There was a lady over here.
Yeah. Hello, I'm Lynn Collins, I'm a member.
Good.
It's going back to membership actually. I'm aware how hard the Trust has worked to get a variety of members, age groups, demographics, etc. Do you feel that holding the AGM at 1 o'clock in an afternoon perhaps puts limits on the interest externally, and that perhaps if it was held in an evening, it would be more accessible to people who are in work? You want students, you want younger members, they're in school. They'd get fined if they weren't in school or in college. And perhaps, or even an alternate year. One year it's held in the evening, 1 year it's held in the afternoon. Just to make it more accessible for other age groups and other demographics to be able to attend these meetings.
Believe you me, it is something that is on our mind, and we are open to have that discussion. And we would absolutely want to encourage, as you say, as wide a variety of membership as we can. And so perhaps we should take that away, and next year have our meeting, say, at 5 o'clock, which would then be open to all.
Yeah, absolutely. Thank you.
The lady is right, but where I live there's a local radio station, Wirral Radio, which is broadcasting this event today, and also at 2 o'clock, 2:30, when other people turn up. So hopefully, maybe something will be said to them when they turn up. Thank you.
Thank you for that. They are broadcasting today, in fact, and we are actually going to talk to them later. I think the point is well made. I really do, and I think we are looking at the way we are constituted. We're looking at how we meet, where we meet, and the times of when we meet. And in fact, we were having a discussion earlier today about the governor portfolio and how we are going to accommodate the younger people in that governor portfolio, because we provide services to those people. So thank you for raising it. You're absolutely right, and we will take that away.
Just a point, hi, John Davis. I'm also a member of NHS Foundation Trust Arrow Park as well, and also Victim Support and several other organisations. But I just wanted to say that recently we've had flyers around, about the fact that Victoria
dental practice, it now takes NHS patients besides private patients, and that's
Good.
down New Brighton though.
Right, good.
But nevertheless,
Good.
there is at least one in that area.
Good, good.
Yeah, that's the main thing.
Thank you.
So if anyone's living there, I mean, they should have had a flyer by now to
Yes,
say it.
if they're seeking to register within NHS
Yeah, that's right. Yes,
practice,
that's right.
they can go there.
Also, something else. I'm also a member of Benenden Healthcare. Now, we have a subcontract with Bupa, and we know Bupa is a big organisation, and John Lack, who is one of the leading members there, said that they have to be very careful that these subcontract organisations, especially ones as big as Bupa, don't try and take over Benenden. But Benenden has a special constitution from when it was first formed.
Right.
But it's not just Benenden that has to worry, it's Bupa itself, because of course Bupa is a Provident organisation, and that could be taken over as well. So although Bupa and Benenden have a good relationship in subcontract, you do have to be careful with these things, especially in view of Virgin Health under the masquerade of Peninsula.
Thank you. It's a point well made. I don't think it needs further contribution. So thank you. There's a gentleman here who'd like.
Good afternoon, Kevin Sharkey, Trust Member. May I ask if our change from community trust status to foundation trust status will have any bearing on the total income the trust receives, or is that based on a population basis?
Mark, would you like to pick that up?
Yeah, I mean, we become a community foundation trust. It'll have no bearing whatsoever. We will still negotiate and commission services in exactly the same way. So nothing will change unless the services that the commissioners are putting out there change, which would have happened either way, whether an NHS or a foundation trust. So no, it shouldn't have a bearing at all.
Okay. Anybody else?
What do you sorry?
Sorry.
So down to what money you get, you decide where it's spent and whatever, like, yeah. You're in control of the money.
We don't decide where it's spent. We submit bids for work that comes up as a tender. We've also got some services which are core services which don't go out to tender, so we commission on an annual basis for that. But we do have to make decisions as to how we use that money in the most efficient way. So that's why when we talked earlier on about our cost improvement programs and reviewing our patient pathways, that's our attempt to make sure that we are using it in the best way and that we're getting the best value for money for taxpayers' pound.
Cheers. Hi, my name is Bob Giles, excuse me. My question is about the Healthy Wirral Vanguard programme. And one of the key aspects of this, as I understand it, is the communication electronically by IT systems between the different organisations, between obviously Arrow Park and Clatterbridge, the CCG. If you give me some thoughts, your ideas on, you mentioned System 1, how close are we to getting it where it's joined up, where organisations can freely exchange information? I got on an email the other day that from Wirral Borough Council that there's a programme of, effectively, the way I understand it, is a summary care record for the Wirral. There's already existing a national summary care record, and I think these are vitally important things. Some people may disagree with all the information, but it's vitally important. We're all on there. And basically is how you will in the future communicate effectively.
No, very good question. Thank you, Bob. As always, right to the heart of it. Val?
Thank you, Bob, for asking that question, because it means I haven't just been sitting here and listening to the other questions. The work that we're doing around Healthy Wirral is around how we can ensure that information is passed across all of the different healthcare systems that we currently have, depending on where it is that you are getting your health care from. So there are a number of systems, whether you're if you're a patient of the Community Trust or Arrow Park or Cheshire Moor Partnership Trust, they all have their own different systems. And part of the work that we're doing through Vanguard is to ensure that those systems are connected. In the first instance, read-only, so that if somebody appears at Arrow Park and has had been looked after by their GP or a community nurse, that can actually see what their last set of interventions were, so that you can actually tie up that care and give the appropriate care at that time. So that's one of the aspects of Vanguard. The first two parts of that piece of work are to connect the IT system, Cerner Millennium, which is the WUTH system, the Arrow Park system, and the GP system, because that will get a huge numbers of the population information connected. And then after that, they will be connecting into our System 1, into CWP's care notes, into the council's liquid logic, so that at the end of the day, you get a whole view of what that person's care is about. What we've done as part of that process is to communicate that out to the public. So that's why you've been getting some consultation information around what that summary care record will be for, and the benefits of that. And so that's where you've been getting some of that communication now, because the part of that piece of work is ensuring that the public are aware of what we're doing, what the impacts are for them, and what the benefits are for them, so that we can make sure that all of that information is tied up in the best interests of their joined up care. Thank you.
Hi. Thank you, Kevin Donovan. Second bite of the cherry, I must confess, because mine was the first written question as well. Yeah, that's my bee in the bonnet. I've got a question about Vanguard, but can I preface that by saying I'm a huge fan of this trust and of its staff in particular. I've had very few encounters with it as a patient, but they've been satisfactory. But I'm on the equalities panel, and I had a very small hand a couple of years ago in helping to choose staff awards. And every encounter, and this meeting, I have to say, confirms it, in the professional, skilled, human, effective way that you've communicated with us. I think it's just top rate. And bugger CQC, you're excellent, you're not good. So that's the preface. The other, though, is my question about Vanguard. We've talked about Vanguard. I think it's a poison chalice. And for a very good reason. Clearly, all the partners. Is that me or is that your system? Yeah. Okay. Apologies.
Keep going.
It sounded like apologies from the bottom of my heart, didn't it? All the partners that we've mentioned are committed to what you are committed to, your vision. But you haven't mentioned another partner. And there is an American partner in Vanguard, and it's an American ACO. And I've changed mics. My God, I'm like Mick Jagger now. I'll have a bottle of Jack Daniels as well, please. The American ACO it might look like a good idea. It's there to help notionally integrate services in a community. But I don't see why we couldn't do that from the skills that exist in the Wirral organisations, and on the basis of a plan we already had called Vision 2018. An American ACO is clearly one that is the Trojan horse for an insurance-based payment scheme. And I think allowing APP, I think they're called, is a hugely dangerous move, particularly when Devo Mank, Devo Mersey, whatever we call them, are coming at the same time as Wirral's 57% cut in budget and the £8 million cut in care budgets for the whole of Merseyside. And frankly, it's all peanuts compared to last year's bankers' bonuses, which were £40 billion in the UK alone. So I think we need to get some perspective both on the motivation for NHS England propagating Vanguard, and the motivation and the dilemmas that you are faced with trying to implement it with the best will in the world. Thank you.
Yeah, do you want to pick that, Karen, and then I can see that?
Hi, Mike. Thanks for that.
Kevin.
Sorry?
Kevin.
Mike.
No, I had 2 mics.
That was good. Well done, you. Right, Mike. I think what you've said makes perfect sense. There is an American partner. Primarily, the American partner is working with us on the IT solution. So it's been working with us on what Bob, I did get Bob right, didn't I, Bob? What Bob was talking about in terms of the interconnectivity of the systems. But, you know, that you're right, there is an ACO behind that, an ACO that's underwritten and pinned by an insurance-based scheme. I think the issue here is how do we get the maximum amount of benefit in terms of service provision out of all the organisations that provide those services for Wirral. So we're not working with a titled model, we're working with a title of integration. And there are actually many models for that. Indeed, I was the chief executive of an integrated health board in Wales before I came here. And it was established in statute. Ask me, was it integrated? No. It was called something. Integration is about a methodology of working. It's about how we do things, not what we call something. So we're trying to learn from that, from our American colleagues. But you're right to say there is another partner. And I will be joining the contract team from the Wirral Hospitals Trust in the contract negotiations of that technological input. I think the other thing in terms of assurance that I can offer you is that there is actually a senior leadership group made up of the chief executives and significant others across the health and social care economy that include our local authority friends around the table that are overseeing the implementation of Vanguard, Healthy Wirral, whatever you want to call it. So just to give you some assurance, you won't see anything happening under the table or around the actual framework of what we're trying to do. We're partners in this, and we're partners in this because what we want to do is make sure we get value for money for taxpayers. And that's where we are at the moment. I don't know whether Val wants to add to anything. Is there anything you'd like to add to that?
Yes, if I can just add a bit more context, Kevin. There are 3 aspects to our Vanguard bid, which actually we're moving away from calling it Vanguard into Healthy Wirral, because Vanguard doesn't mean much to many people. But there are 3 aspects to it. One is integrated care, which is our model of provision. The second is around the interoperability, which was the issue that Bob raised. And the third bit is around population health, which is where the American partners do help us. And the population health model is for us to understand across Wirral where the greatest needs of the population are when it comes to diagnosing different kinds of symptoms and groups of diagnosis. So the 2 first pieces of work that we're doing with them is around respiratory care and around diabetes, because what we want to do is to build it up from the lowest level of the population up, so that we then can start to say that actual needs of that part of the population have this greatest need, so that we can then start to transfer the money where the greatest need is around that population's need. So you'll have your individual, your family, your street, your community, and then your, the whole population. And I think what that will really do is help us to crack a nut that we've never been able to do on Wirral, and that is we've got such a big divide between life expectancies between the west and the other parts of Wirral. And actually, if we can really understand what the needs are and direct that resource to where those needs are, then hopefully we'll start to bring back, narrower that divide between those people that live longer and have healthier lifestyles in Wirral than others, which, to our shame, we've never been able to crack. And we believe this population health model will help us to understand that much more, so that we can, put the resource in the right place, really. I hope that helps. Thank you.
I hope that clarifies that point. Thank you. Up now.
The little community hall in the grounds now, do you own that? Right. A couple of years ago, there used to be a fibromyalgia group on the Wirral. And my consultant asked me last year if I was interested in trying to start up a new group. And I was wondering if somebody could give me help or advice how to sort of go about introducing a new group on the Wirral.
Isn't there already a group?
No, there was one in Ellesmere Port.
There was one that used to be in Adam Park.
It's gone.
Is it gone?
No, it folded up 4 years ago. And I was just wondering,
So you're looking for help to set up a group?
try and get one
I
set
think
up.
that's something we need to take after the meeting. Don't we?
Yeah, happy. I was going to say, we're
Yeah.
going to talk anyway, so we'll pick it up.
Lady here. Thank you.
Margaret DeWolf, I'm a trust member. The 95% patient satisfaction is a wonderful statistic. How are you going to make it known? Talk to the average person on the street and they will always have negative views. They'll tell you the horrors of Arrow Park or wherever else. How are you going to get it known? Because it's a wonderful statistic that you should let everybody know about.
It is, and we're very proud of it. And of course, Arrow Park will have their own.
Yes, but it's the NHS as far as people are concerned.
I know. Many people don't understand that the different fragments. Jo, will you pick that one up?
Yes, certainly. We do try to do a lot to publicise our successes, and we're currently setting up an arrangement with the local newspaper to have a regular slot in the Globe, in the Wirral Globe, got the right one, where we're able to talk about what we're doing as a trust to publicise our services further, so that people who maybe don't currently access them or just aren't aware of them become aware of what we do and our success as a trust. So we're trying very hard to improve the awareness of the public in Wirral around our services, and to share, as you say quite rightly, share that success.
There's a gentleman here who has a page in the local paper. So perhaps you
Well, we're going to have a we're going to have a regular page, and Karen is going to have a regular column.
I was going to say, Margaret, I'm going into competition with him.
Yeah.
I actually think that's a very, very good point. I was having words this morning in the other room, and I brought up that. Sorry. I think that was a very, very good point. I was having words this morning when I came with one of the members of the hospital about that very subject, because I am very, very proud of what this trust does and the achievements that it makes. It not only meets the targets, it actually exceeds the targets. And I was worried about the communication, because I was asked the question, you know, do the council know? Do we get the information? I think, in truth, no, we don't. And I think a greater communication needs to be had there, not only with the council and the trust, but also with the community and the public. You have got a lot to shout about. You have got a lot of successes, and I think the public needs to know that. I know it's a difficult thing to do, because you can put a lot of publicity out and you will still get people that will come back to you and say, well, I didn't know about that. But I think it's inevitable that we have to try as hard as we can.
Because bad things are always more newsworthy.
Yeah.
Absolutely. And I welcome the competition with the colleague.
I can't leave it there, can I? I'm only joking. Thank you, Margaret, very, very much for saying that. We are going to do some work with the Wirral Globe, but I think you've hit the nail on the head. The bad things are sexier, aren't they? They make better read, make better copy. But we are working with Wirral Globe, and they have been gracious enough to talk to us, and I'm actually meeting with the editor shortly. We are going to talk about how we can talk more about the trust. Not just about praise for the staff, which is very, very important because they deserve it, but also to inform the public about what we do. Because it's very easy to understand what a hospital does. Everybody knows what a hospital does, but when you talk about community services, and I have a paraphrase, it's not just community, it's out of hospital. Everything else that happens, 80% of healthcare is provided out of hospital, and it doesn't get a look in. So that is my mantra. I want to actually say, well, what do we do out of hospital and why is it important? And the reason it's important, so if I go back to what Val was saying earlier, you look at the pathway of care and the way it is funded at the moment and it's configured at the moment, a lot of those pathways of care need changing right from the grassroots. So if 70% of something is done in hospital at the moment, doesn't necessarily mean it needs to be done in hospital in the future or even now. It just means it is because it is, and that's the way it's always been done. We might say, actually, with technology and the skill of the community workforce now, which, and I was a community nurse, knocks everything I did into a cocked hat. we will be able to do 40% of that 70% in the community. And that's why we've got to work across Healthy Wirral, because it's important that we pull those services out and we provide care nearer to or actually in people's homes to help them live independently and not actually be dependent upon the health service. Thank you.
Chair, when St Catherine's first opened many years ago, it was known as the Tramway Workhouse. And on the opening ceremony, a plaque was unveiled on the wall near roundabout G and H wards, thereabouts. When this building was the old building was demolished and this new one was created, I made inquiries as to what had happened to that plaque, because to my mind, it would be a nostalgic and certainly an interesting centrepiece to the foyer of the current building. And with the advent of the Trust Board offices moving up here, it would certainly be an asset to the identity of the Trust. I've made inquiries of our previous Chief Executive, and I now throw it in your lap, Mum, as to what has happened to these plaques. I was given to understand they had been saved,
Yes.
and somebody did say at one time, oh, they've been installed over there, but I've checked and they're not there. So could inquiries please be made as to what has happened to these? Because apart from them being nostalgic, they, to my mind, are quite valuable.
Yes, thank you. Yes, I understood that they had been saved, and so if they have, then we need to have them out and up. So we need to look into that, don't we?
Yeah, you've laid a challenge at my door, and I'll take it up. Thank you. Yeah. Absolutely. I'll try and find out what happened to.
Thank you. Can anyone remember what the inscriptions were on the plaque?
Well, not off the top of my head, but can you help us with that?
No, I can't. Actually, that's why I asked.
But
it must be that this establishment was. It must be. It should read something like, "This establishment was founded on such and such a date."
Yes. Yeah.
Originally, it was a warehouse or establishment for people who were in unfortunate circumstances, either healthily or financially. Then on so and so, it became a hospital for the seriously ill or whatever, something like that.
Thank you. I think the point is that it's an interesting piece of history that we should hang on to.
Oh, yeah.
A little bit. There was another question over here, I think, wasn't there? There we go.
It was just a comment I wanted to make. The Mayor is here representing Wirral. I have a background of information on library services, and we do, even with diminished hours, we still do have these centres and one-stop shops, and I think that there should be more information in them about what happens within the organisation.
Oh, that's good. Very good point. Very good point. I think we need to follow that up.
Hi, I'm Carmel Calvert and I'm a member of the Health Watch Wirral. I just wanted to ask you about your plans to review the urgent care services on Wirral. I know that I believe you have plans to do that, and I know there's a lot of confusion about the various buildings where you have different services at Arrow Park. We've had a lot of issues. People have, written into us or complained to us. They're not sure where they're going half the time. So, can you just tell us a little bit about what your plans are to review the services?
Val?
Thank you. I can't quite see where the question came from. Yes, thank you for the question. Really, it's a question that's directed at commissioners. The commissioners are currently consulting on what they believe urgent care should look like on Wirral, and there has been some information out into the public to ask them what they would want to see from an urgent care provision. Because rightly, as you say, there are so many different ways for people to access services, and it can be really, really confusing. We provide some of those services because we provide the walk-in centres and some of the urgent care centres, and obviously there's the all-day health centre currently at Arrow Park. So we're watching with interest exactly what it is that people in the public would like to see for what their urgent care needs. Because what the commissioners will do is they will talk to us once we get all of that information to see how we can work with them to put those ideas and plans in place. The other thing that we're working on is whether we should have what they call a single front door at the Arrow Park site. So actually I was at a meeting planning this morning, and this we hope would be that there would be an ambulance access into the Arrow Park site, and then the other would be where everybody else went through, and there would be professional staff both from the accident and emergency department but also from primary and community services to do that triage clinical assessment at that point. And then people would be directed to the best place for their care, which might be admission to hospital, but might not be. And the importance of having primary and community staff at that front door would be they would know exactly what other services were available in the community so that people get directed to the right place. And we hopefully stop a number of perhaps inappropriate admissions into the hospital so that they're freed up then to manage the seriously ill patients that they would have to do. So that piece of work's going along alongside it, but the urgent care consultation is out in the public domain at the moment.
Thanks. Thank you, Frances. Can I just add to that? Did you say you were from Health Watch? I can't quite see. Is
Health
it Carol?
No, it's not. It's a lady from Health Watch.
Right. I think it would be very helpful on the basis that that work is being done if you can have a word with your Chief Exec, Karen, who I met with last week, and collate what you've said you've had in terms of feedback. The commissioners would welcome that because it will form part of their view and form part of their decision making about what they want us or Wirral hospitals or others to do. So I think I would garner that and give it to the commissioners. Thank you. Thank you, Chair.
Well, I think we're going to close the meeting now.
Sorry.
Thank you. We've gone well over time, and I think everyone's had plenty of opportunity to raise some very, very interesting questions. The team aren't going. I know you've had a couple of questions. The team aren't going, so if you want to come forward and have a word with anyone, that the health fair is outside, and we'll be up and running. So thank you. Thank you to Mark for making the finances almost understandable to us lay people. Thank you, Karen, new Chief Exec. Welcome. You're already showing great leadership for this organisation. Thank you for that. Thank you to the Mayor for joining us today. And thank you, everyone. You've shown, it's lovely to see such interest in our community trust. So please keep coming, please keep contributing. We welcome it. Thank you all for making the effort today. Thank you.